Good morning, everybody, and welcome to the European Centre for Disease Prevention and Control press conference. I'm Andrea Nilsson, Communication Officer at ECDC. Today, we will present the latest trends for 5 sexually transmitted infections. The reports will be available at 12, and we have today as speakers Dr. Andrea Ammon, ECDC Director, and Dr. Lina Nerlander. She is a principal expert in sexually transmitted infections at ECDC. To ask questions, please remember to raise your hand or to write them in the chat, and then we will give you the floor. Please remember also to turn on your cameras before you start speaking. This press conference is being recorded and will be made available on the ECDC YouTube channel afterwards. Thank you for joining, and Dr. Ammon, the floor is yours.
Thank you, Andrea, and thanks to you for joining us here today as we're publishing new data on sexually transmitted infections across Europe. Unfortunately, the numbers paint a stark picture, one that demands our immediate attention and action. In 2022 alone, more than 70,000 cases of gonorrhea were reported in the European Economic Area, marking the highest annual number in the past decade, and an increase of 48% compared to 2021. This surge is staggering, as it is troubling. And similarly, chlamydia cases rose to more than 216,000 in the EU-EEA, with an increase of 16% compared to the previous years. In case of syphilis, countries witnessed a significant uptick, reaching more than 35,000 cases in the EU-EEA, representing an increase of 34% from 2021. While the majority of cases were reported in men who have sex with men, we are seeing increases in women and heterosexual men as well. Syphilis is also a disease or infection that can be transmitted from mother to child, causing so-called congenital syphilis. Our most recent data on the number of cases of syphilis among newborns indicate an increase also in this number of cases. And these numbers, as big as they are, most likely only represent the tip of the iceberg, because surveillance data may underestimate the true burden of syphilis, gonorrhea, and chlamydia due to difference in testing practices across access to sexual health services and reporting practices across the countries. These increases are a significant health concern and indicate an urgent need to strengthen prevention strategies and comprehensive health education. So why is it so concerning? Because beyond the statistics, there are real-life consequences. Untreated STIs can lead to a range of complications, including pelvic inflammatory disease, chronic pain, infertility for chlamydia and gonorrhea, and neurological and cardiovascular issues for syphilis, amongst others. Untreated syphilis, as I mentioned already, during pregnancy can lead to serious adverse outcomes in the infant child. Furthermore, individuals who have been treated for syphilis, gonorrhea, or chlamydia remain susceptible to reinfection, underscoring the importance of prevention and efforts and regular STI screenings. So, what can be done? I want to highlight 3 key pillars to address the rising numbers, and these are testing, treatment, and prevention. Testing is paramount in our efforts to curb the spread of STIs, and early detection allows for timely intervention and prevents further transmission. Countries should ensure equitable access to testing services, particularly for vulnerable populations and underserved communities. This includes promoting testing for STIs for populations at risk, and expanding access to testing via innovative testing methods such as online testing services. There is also a need to increase awareness of the risk of STIs among young people who may not consider themselves to be at risk. Next, treatment plays a crucial role in mitigating the impact of STIs. Individuals diagnosed with STI need to receive prompt and appropriate treatment to prevent complications and halt transmission. So healthcare providers should remain vigilant in diagnosing and treating STIs, adhering to evidence-based guidelines and monitoring for antibiotic resistance. Now, although I mentioned it as last, I think prevention is always better than cure. So prevention lies at the heart of any long-term strategy. Education and awareness initiatives are vital in empowering individuals to make informed decisions about their sexual health. Promoting protection, practicing safer sex, and fostering open dialogues about STIs can help to reduce transmission rates. So I urge everyone to take proactive steps to protect themselves and others. So the use of condoms, getting tested before or after engaging in unprotected sex, and seeking treatment immediately if you suspect to have an infection. And also healthcare professionals, I encourage to engage in an open dialogue with patients, inform them about preventive measures and the importance of testing before or after engaging in unprotected sex, and provide treatment options. What we should remember, there is no shame in STIs. They are diseases and should be treated as such and without judgment. So the conversation should be normalized, because STIs, as you have seen, are common and they can affect anyone. So in conclusion, the rising rates of STIs in Europe demand our immediate attention and concerted action. By prioritizing testing, treatment, and prevention efforts, we can turn the trend and safeguard the health and well-being of our communities. So from ECDC, what we are doing is we will continue to have discussions with the experts in the countries in our STI network, share experience across countries on how to respond to such increases, and share the results of investigation. We are also working on gathering data from sexual behavioral surveys, which will help us and the country to understand the underlying drivers for these infections. This year, we will also implement a program to better understand the policies and practices that are in place in member states, to get a better overview of the situation in this region and to see in which countries the existing efforts need improvements. Finally, we will continue work on the EuroGASP program, which is a program to monitor antimicrobial resistance for gonorrhea, through which ECDC monitors the emergence of antimicrobial resistance in these infections in the EU. Through this program, ECDC can also offer additional support to countries for antimicrobial susceptibility testing or whole genome sequencing. So we have to work together, because only then we can tackle this public health challenge head on and ensure health for a healthy future for all of us. Thank you.
Thank you very much, Dr. Ammon. Now we give the floor to Dr. Lina Nerlander.
Thank you very much, and good morning. So I would like to highlight some trends in specific populations that we see. So among men who have sex with men, we've seen a gradual increase in many STIs over the last decade or so. And then in women and in men who are infected through heterosexual transmission, there's been some increases earlier, but really the major increase is what we see in the last year. we've seen a particularly large increase in gonorrhea in young people. So here at ECDC, we've done a special investigation on that, and we have asked countries to submit data early for 2023 as well. So we looked at gonorrhea rates before the pandemic in 2015 to 2019, and based on the number of cases reported there, we estimated what would be expected in 2022 and the first half of 2023 had rates or had cases continued to be the same as before. So what we saw there was we had more cases than expected in all age groups, both for women and for men due to heterosexual transmission. But we had particularly large excess of cases in women aged 20 to aged 24. Here, in the second half of 2022, we had 73% more cases than expected and 89% more cases than expected in the first half of 2023. And for men in the same age group, 20 to 24 age, we saw 36% more cases than expected in the first half of 2023. So what lies behind some of these increases in gonorrhea and in other STIs? Well, there are a range of different options, of different hypotheses that needs looking into further. One part of the picture could be that there's changes in testing practices, where countries are making home testing, ordering online testing, home sampling more available, and then more people are being tested. Also, groups at high risk for STIs are being screened more regularly, and they're also being tested in different parts of the body, so also in the throat, for example, which might be picking up more cases than we saw before. Because many STIs, you can have an STI without having any symptoms, and then of course, if you test more, you pick up more cases. But increased testing is not the whole story. There could also have been changes in other factors such as sexual behavior and condom use. So, for example, we now have really good treatment for HIV, which is great news. And some men who have sex with men who are HIV negative, they also take preventative HIV medication to prevent them from getting HIV infected. And that's also fantastic news. But that could also influence people's decisions about whether to use a condom or not. And of course, if you don't use a condom, you're at risk for getting an STI. There could also have been changes in sexual network, how people meet people, for example, using online dating apps. And for the increase in young heterosexuals in particular, we are looking into why this might be. But one option or one hypothesis is that something has changed after the pandemic in terms of sexual behavior. So that this group of people who are kind of coming out of the pandemic at this age group, they might have different behaviors than earlier cohorts. This could be the number of partners people have, the types of sex, and also how people are networked with each other, which means that depending on who you have sex with and who they have sex with, that could kind of influence how STIs spread in the population. At this point, we're not seeing any evidence that the increase in young people is due to antimicrobial resistance, but we are definitely keeping a close eye on this through the Eurogasp surveillance system, as mentioned earlier. So more studies are definitely needed to understand more about behaviors, understanding sexual networks and what strains of gonorrhea spread in different sexual networks. But the good news is there are things that we can do already today. So I would like to reiterate some of the messages around testing, treatment and prevention. So for testing, to promote the message that testing, to destigmatize testing, that testing is not a big deal. It is something that you should do to take care of your own health and that of your sexual partners. Get tested if you're going to stop using condoms. Get tested after having unprotected sex. And talk to your partners about getting tested. And then for treatment, improve access to treatment and also make it destigmatize treatment and make it shouldn't be kind of a barrier to getting treatment. Shame and stigma shouldn't be a barrier to getting treatment. And physicians should take samples for, when they treat gonorrhea, to take a sample for antimicrobial resistance, and then also ask people to come back for what's called a test of cure. And that is a test that is taken after gonorrhea treatment to ensure that the gonorrhea has gone away. And these things can help us pick up resistant gonorrhea quickly before it spreads further. And finally, prevention. So as was said earlier, we need to raise awareness among young people about the risk of STIs because they might think it's a thing of the past and doesn't affect them. And this could be done through a variety of methods, social media, and also in educational settings because we are seeing increases in teenagers. And then promote the use of condoms for vaginal sex, but also for anal sex and for oral sex. And then reiterate the message that testing is a really good way to take care of your own health and to take care of your sexual partners. So we hope that the reports that we publish today will help you all communicate on this important issue. Thank you.
Thank you very much, Lina. Now we open the floor for questions. Please remember to raise your hands or the chat, and then we will give you the floor. I see there is one question from Sarah Heyman, Swedish Radio. What can you say about the reasons behind the surge of STIs more deeply from what you know at the moment? This was just addressed by Lina in her talk, but Sarah, would you like to ask any follow-up questions? Good. Okay. So please raise your hands. I see Lauren Chadwick from Euronews. Please, Lauren, turn on your camera and ask your question. Go ahead.
A bit. You said they're not seeing evidence due to antimicrobial resistance, but could you talk about why this is so important to monitor and what type of role this could potentially play in the future and what you're monitoring with gonorrhea specifically?
Mm-hmm.
Thank you very much, Lauren. Andrea, would you like to start?
I start and then give the floor to Lina. We have already seen cases of highly resistant gonorrhea where there is almost no treatment option left. Although these cases are few, I think we have to be very alert and vigilant to make sure that as soon as any resistance occurs, that we pick it up. Lina, please.
Yes, thank you. That's right. So through the Eurogasp surveillance system, we are monitoring samples from countries each year, and they are tested for antimicrobial resistance. And that way we can see the percentage of isolates who are resistant to different types of antibiotics over time and how that changes. And we do see some increases over time in different antibiotic profiles. So that's why it's important that physicians follow the recommended treatment guidelines from, for example, clinical organizations like AERs, and to stay on top of current recommendations. It is important because, of course, if drug-resistant gonorrhea spread, then they are harder to treat, and then the more people have them, that it's harder to treat in more people, and it could spread even further. And so far, the cases that have been resistant to several antibiotics have mostly been imported, some from Asian countries, and there have been just a few cases, and luckily it hasn't looked like it's spread much further. But we definitely need to monitor this, and of course get tested, and if the sample is not tested for antimicrobial resistance, those strains could go undetected for longer, and that's really what we would like to avoid. And this is a scenario that we are preparing for at ECDC and together with our network of STI experts in all the member states. And that's why actually a few weeks ago, we hosted a simulation exercise here in Stockholm where experts from many countries, also from WHO and from partner agencies gathered here for a day and a half to play out a scenario where we kind of estimated, we had kind of pretended that there were cases imported and that they spread further, and countries together with agencies were kind of planning how to address this. So we continue this dialogue, and we'll continue the surveillance through the Eurogasp system to make sure that we pick up when these cases come and that we can address them quickly. And that also puts the burden on physicians in a way to do testing of gonorrhea cases, and to, if there is a resistant case, to do partner notification and to follow up, and for individuals to notify their sexual partners if they have been diagnosed with an STI. So we hope that all those efforts will help us avoid the scenario of having many cases of drug-resistant gonorrhea in Europe. Thank you.
Thank you very much, Lina. I don't see any more hands yet. So maybe we can look at the questions that we received offline before the start of the press conference. How did the COVID-19 pandemic impact the spread of STIs? And are there any notable trends or during this period?
Yeah, I will start again. And for STIs, like for some other health conditions, the impact of the pandemic was quite significant. Often the services for STIs were closed. People working there were requisitioned for the pandemic, and there were less tests and treatments available. There might also have been that pandemic restrictions have had an influence on the behavior, sexual behavior, that people didn't come together as much. But I think that is why we are seeing now such a rebound. Lina?
Yes, thank you. I think there's definitely 3 levels. Sexual behavior, people met other people less due to the restrictions, so there was less transmission probably. Then there was less access to testing. Services were closed or repurposed, and people weren't as mobile, so they wouldn't go out for testing as much. And then also, even if cases were diagnosed, maybe people didn't have time to report them as efficiently as they did earlier. So that is definitely, we did see a decrease in several STIs during the pandemic. And we are seeing increases now, but we also, as I mentioned earlier, we are seeing increases relative to pre-pandemic levels, especially for gonorrhea, which I just mentioned, our special study. So it's the impact of the pandemic is complex, but now we're coming out of it, and we need to look ahead to and monitor trends to see where we're heading.
Thank you very much. Any other hands raised? I don't see any just yet. Okay, we go with another question. Are there any challenges or barriers hindering efforts to prevent and control STIs? And if so, how are these being addressed? Andrea? Lina, please go ahead.
Yeah, so there are, I think stigma might be an important barrier. That it's shameful to talk about STIs, it's shameful to say that you had an STI. So that is definitely something that could be addressed in terms of destigmatizing, talking to your sexual partner about STIs, talking about getting tested and using condoms, and then not being afraid to seek healthcare services, understand that the test is easy, it's easy to treat. I mean, that is the message here. STIs, these bacterial STIs can be easily treated. So that's kind of the good message here. Then there's also challenges in terms of access to testing for particular populations, maybe migrants, homeless people, people who inject drugs. So kind of breaking down the barriers and increasing testing for everyone. And then in some places, there could be inadequate resources for STI prevention and treatment services. So that also needs addressing. And then also, like, we don't have, there are tools. We need more prevention and tools for STIs as well. So research is important. The development of new tools is also something that should be encouraged.
Thank you very much, Lina. Do we have any questions from journalists in the chat or any hands raised? I can see any just yet. So we go with the last offline question. What is congenital syphilis? How big is the increase? And what can be done to address the situation? Please go ahead.
Yeah, so as I said, congenital syphilis is when the syphilis infection is transmitted during pregnancy from the mother to the unborn child. And it's particular in the last part of the pregnancy where this transmission occurs. So it's also important to diagnose pregnant women as early as possible to find in case there are symptoms to have a syphilis infection, so that treatment can be done. The increase I leave to Lina, please.
Yes, so in 2022, we had 69 cases reported from 14 member states, and that's up from 55 the year before and 48 the year before that. So we do see an increase, and there's a few countries with more cases than others. And what's important here is to ensure that there are no gaps, that pregnant women are being tested for syphilis, and that cases that are being, that unfortunately still occur, that healthcare services follow up to see where that case was missed, what could be done to prevent this in the future, and kind of do an investigation and figuring out how services can be improved. Because if the mother has syphilis in pregnancy, it's a very, very high risk that the baby will be affected too, and that can cause stillbirth and then serious complications in the newborn child. So this is something that's definitely worth paying attention to, especially in the light of rising rates of syphilis in women that we see in Europe.
Thank you very much. We have a question from Silvia Martinez from El Periódico. Silvia, please go ahead. Are you there?
Yes, sorry. I couldn't put the camera on. I just wanted to know, I mean, if you have figures for member states, what if there are differences between the EU countries, and if the situation is particularly worrying in some of them, and what would be the reason? Thank you.
Yeah, go ahead.
Yeah, so in general, there are differences between the countries, and in general, we see a gradient from west to east that is decreasing. But that still doesn't mean that also countries in the western part can have lower rates, and countries in the eastern part can have higher rates. I leave the details to Lina.
Yeah, I mean, there are definitely differences in across Europe, but it's hard to tell whether those differences are in terms of actual cases or due to different testing practices. And we know that there's a big variety in the frequency of testing and accessibility to testing in different countries, and also kind of the reporting systems. So that's why it's tricky to compare across countries, kind of between countries, and say which is worse in which country. I think that highlights the importance of doing really good surveillance that even if physician and you're busy in your clinic, it's really important to report those cases that you diagnose, because that helps paint this overall picture that we can then take action on. So good information and good surveillance is really important. And moving forward, we are also doing setting up a monitoring system, where we will be looking at policies, for example, testing practices and policies in different countries, and collect this data more systematically across Europe. So that means that we can kind of put the data in context with also what we know about what goes on in terms of policies and practices in different countries, and also to identify where improvements can be made. But I think, yeah, for congenital syphilis, we have a few countries with more cases, and I think efforts are going on to kind of understand why this is and what can be done about it.
Thank you very much, Lina and Andrea. Do we have any further questions? I do not see any hands or any questions in the chat, so we can close this press conference today. Thank you very much for joining, for your interest, and please do not hesitate to reach out to us if you have any further questions or any feedback. Our email address is press@ecdc.europa.eu. Thank you very much, and thank you to our speakers. Have a good rest of the day.
Thank you.